reading, and for exams. I think you've been told about that Okoa time, eh? Yeah, we see so many of you coming to the library. Some of you have never even come. They come at that time. So I welcome all of you to the library. We'll give you all the resources, all the guidance you need. We are there for you because we are all information scientists. So we are able to guide you on what you need according to the subjects you're doing. We have all the books, we have all the materials. I see some people coming during exam and telling me, hey, I wish I had seen this when I joined school. So at least come to the library and see. So the location of the library is just there. I think everyone passed through library during registration. Kuna mtu hakupitia library? It's just here, just across here. So our library opening hours on Monday to Thursday, we open from 8 a.m. to 10 p.m. usiku. 8 a.m. to 10 a.m. to 10 p.m. On Friday, we open from 8 p.m. to 9 p.m. On Saturday, we open from 9 a.m. to 3 p.m. The eligibility for registration in the library is a student ID. And immediately you join Kabete National Polytechnic, you are eligible to be a library member. So everyone is welcome. So we issue 2 books for 7 days. And if you bring the books late, we fine you a small amount, 10 bob. Hizo ni kama madazi bili hivi, zinapotea tu hivyo buli. But if you don't want your madazis to get lost, you can renew your books. Ukimaliza, ukiona hujamaliza kusoma, you can come renew the book once, subject to the demand of the book. Our library is arranged using the Library of Congress. You might come there, uone kitabu imeandikwa A, B. That's called Library of Congress classification scheme. Those ones who are doing information studies will understand this better. And the books are arranged from A to Z. So your area, you'll be shown when you come to the library. But we have an OPAC, which is an online public catalog, which you can access even from your phone if you have internet. You can type library.kabetepoly.ac.ke, library.kabetepoly.ac.ke. You'll be able to access our catalog, and the catalog will show you the collection of materials that we have in the library, so that even if you are not in the library, you'll be able to see what we have, and you'll be able to locate the books you want. So I welcome you to our library, and you'll never regret coming to the library. So as you settle down for your studies, remember that the library is here for you, not as a boring and overwhelming place, but a space full of opportunities, resources to make your academic life easier and more enjoyable. So it is your partner in learning. So we can't wait to see you to make the most of it. It is the coolest place that you know that ever existed in Kabete. So I hope to see all of you there. We will talk more. If you didn't understand anything here, you can come and ask us. So karibuni sana kwa library. I hope I'll see you. How many will come? Kwani sijasema kitu. Okay, you're welcome. Okay, God bless you and wish you all the best in Kabete.
Coffee. I'm talking for semester as early as now. Anza kuzoea library. Naona venye Tweli anasemanga zoea hiyo sauti. So ni mwanze kuzoea library. As soon as mwalimu amekupea assignment, make a point of visiting the library. Sawa sawa? Haya. I lost and found. There was someone who lost their birth certificate. Whitney Mokeira Bosibori. If you're somewhere and you're hearing your name, tuko na cheti chako cha kuzaliwa. So the next person I'm going to invite is Mrs. Mtua for guidance and counseling.
Good morning once again. Yes, as we've been told, Mrs. Mutua Christine, I'm head of Guidance and Counseling Department, and I said in that department we are also handling issues of gender, and so I'm here to again say karibuni sana and say something small about guidance and counseling. The way it is structured in Kabete National Polytechnic, we have an office. My office is located almost opposite the student center. You saw where the student center, where there's good music. Ukiangalia huko chini kwa uwanja huko, tunakuitaka Kawangware. That is where guidance and counseling is. And all people are welcome to come. The structure is such that we have that office where I'm working with several officers. Mr. Milambo, I don't know whether he's here. We also expected Mr. Emmanuel, they are supposed to be coming, and others. But we also have departmental counselors. So in your department, you are going to find departmental counselors, people that are going to handle your issues. So when you go to your department, ask, who is my departmental counselor? And so that if there are issues that arise during the department, kindly be able to talk to someone. If you can't reach that departmental counselor, walk to the office. The environment is safe, is secure, nobody will know you came. We keep utmost confidentiality. I know sometimes in high school and other places, you've shared your information, then you find it all over. I want to assure you that the office is run by very professional people, and we don't share out information even to parents unless we have agreed. There is utmost confidentiality. And so we invite you to come and benefit from the services. Who goes for counseling? I want us to answer that question. The reason why I'm answering that question is because of the misconceptions that are there. Some people think that people who have mental illness, people who are sick, people who have problems are the ones who go to the counseling. That is some, could be true to a certain extent. When you have challenges, you can go to counseling office. And I know from high school, ukianguka mitihani ulikuanga na unaambiwa uende wapi? Counseling, sio? Ukipatikana ukivuta nini unaenda wapi? Sasa huku Kabete na huku counseling ni ya kila mtu. Guidance and counseling is for normal people going through normal day-to-day issues. So all of us, including huyu mwalimu munaona hapa, even me, I usually go for guidance and counseling. There are sometimes I go to my principal and I tell him I want to be counseled. And then I also go to a counselor and I tell him I want to be guided because I don't know everything. There are things I need to know. And why is it that it's important that all of us get to the guidance? Because you will get information there. You'll get support when you're going through problems. And you can also bring another person who is going through trouble. So all of us are candidates for guidance. I want you to know that we are going to be here. We are going to guide to the departments. We are going to call meetings. We organize a lot of events. We are going to have VCT, voluntary counseling and testing, where all of us will be able to know our status and be able to live right. We will also have other activities. We are going to call you up for talks. We call people to come and do talks on the point of topics that are meant to help you. So we are going to be inviting you for those topics as we go on. This morning, I will not say much about the guidance and counseling, because what we have done is that we have invited a specialist. We have one of us, we have one of us, a father in this nation, a man that has touched so many lives in this country. In terms of counseling, in terms of visiting, in terms of gender-based violence. And I want to give him some few minutes and your musikie vile kuko. We want to invite you and we want to say that we care about you, and we have even gotten guests to come and speak to you. So help me invite Mr. James Ndongo, who will say more about himself as he talks to you. Put your hands together for Mr. Ndongo. Thank you, thank you, thank you, thank you. You're welcome, Mr. Ndongo.
Asante Madam Mutua. God is good. All the time. And all the time. God is good. Mungu ni mwema. Na kila wakati. Yes, my name is Ndongo Kiru. Am I audible at the back? Mnanisikiza hapa nyuma tafadhali? Yes, so my name is Ndongo Kiru. I work in the HIV and AIDS space, and also in the ADA space, alcohol and drug addiction. I'm a HIV advocate. I lobby for rights of persons who are living with HIV. I'm also a counselor. I test guys like you for HIV. And I'm also an adherence counselor working in a CCC, a comprehensive care center. So I create awareness basically on issues to do with HIV, alcohol and drug abuse, and gender-based violence. So navaa kofia mbili, moja ni advocacy ya mtetezi na ingine ni ya healthcare provider. So I've had sessions with a number of students in institutions of higher learning kama NDTI, which is now Nairobi National Polytechnic, Kiambu Institute, that's Kiambu National Polytechnic, Thika, and also saa leo nimekuja huku. Basically, my role is to hold space for persons who are living with HIV and also create awareness. So leo nimekuja ili to stimulate dialogue kidogo. I give you the position of how we are faring as a country, preventive measures, and the way forward. So let me wacha niongee kuhusu HIV kidogo, alafu nitaguzia ADA. The data that we have from the National Syndemic and Disease Control Council, formerly NAC, National AIDS Control Council, from last year, inaonyesha the age group ya 15 to 34 years, the prevalence of HIV is at 73%. Kwa hivyo ni vizuri tujue, na nikiangalia hiyo age naona wengi wetu tuko hapo. Kenya has what is known as a generalized HIV pandemic. When you talk about a generalized HIV pandemic, it means that it affects different age groups. But in a generalized pandemic, tunapata ya kwamba women and young girls are disproportionately affected. Inamaanisha kwamba wasichana wetu na wasichana na wamama wameathirika kuliko wanaume. And that's why we need also structural interventions for young women and for women basically. Alafu, the other thing worth noting is that around 1.4 million Kenyans are living with HIV. It's very important to you to note that. And then 1.2 million Kenyans are on care and support. Leading counties are in terms of prevalence with 11.7%. Tunaweza sema ni Kisumu. Counties with the lowest prevalence, tuna Northeastern Province. Garissa, Wajir, Mandera, and pia Marsabit. 40 years ama 41 years after the pandemic, what are our major gains and misses in our HIV response? Unaweza sema ya kwamba currently most people who are living with HIV right now, they are solid contributors in workplaces, and their quality of life has been enhanced tremendously due to antiretroviral therapy. Na Kenya imepiga hatua sasa historia ya HIV because people are using a fixed dose combination wanameza tembe moja. So HIV infection it's not a death sentence the way it was in the early 80s and early 90s. Hapo tumepiga hatua. Intensified HIV awareness campaigns. Hata this one is a HIV awareness campaign. So information on HIV bado iko juu. But kuna changamoto kadhaa. And especially for young people, because that's where we are getting the newest infections. And that's why we need strategies, especially kwenyu mkikuja Kabete National Polytechnic as an institution of higher learning, muwe HIV and AIDS competent. Na muwe vile mnaweza jipanga. Because I've been in the HIV and AIDS space for the last 17, 18 years. And I can tell you, it's not business as usual moving forward. Because wengi wanaathirika vijana. Wanaathirika na HIV. So we need vijana tuna need to kujipanga. Kulingana na KDHS, Kenya Demographic and Health Survey, inaoneshana ya kwamba changamoto ziko. One of the challenges I think for young people issues to do with stigma. And stigma is a stumbling block in our HIV response. Because watu wanaogopa kutest, guys are not upfront about their HIV status, and also people are afraid to take medications. And I believe Kabete National Polytechnic is a stigma-free institution. So hiyo hakutakuwa na shida, pengine hata kama mtu ako na hiyo shida kukuza. Nimesikia mwalimu akisema confidentiality is key. So even what I'm doing right now, this is also a stigma reduction campaign. Alafu ile kitu ningesema changamoto ile nyingine tuko nayo ni ya kwamba clinically HIV is very manageable in the country because it's a one pill, but physically and emotionally inakuwa kuna challenge, and that's why it can lead to poor health outcomes. So we need robust support systems because young people in our treatment and care cascade, pali kuna shida in our HIV response as a country is for young people 15 to 24 years. Nikiangalia kwa sababu nimefanya kazi na hospitali tofauti, because wengi tuseme hata kama ni vijana, they are going off the rail in terms of treatment, wanaachana na madawa, wanakuwa na high viral load ama kitu tunaita high viremia. So we need robust support systems for young people. And then again, research inaonyeshana ya kwamba the likelihood of being diagnosed with depression is twice high amongst persons who are living with HIV than amongst the general population. So the country also need to integrate maneno ya HIV na maneno ya mental health. That is also very, very important for us as a country. Then as people age in their 40s and 50s, ile shida ingine imekuja in the country is about non-communicable diseases. So the country needs two key areas: HIV mental health and HIV and non-communicable diseases. Nikiangalia pia naweza sema about when you talk about hii maneno ya HIV, because tunaweza sema the sexual transmission inachangia sana hii maneno ya HIV in the country. As much as Kenya has a generalized HIV infection, maneno ya sexual transmission imechangia zaidi. And I've been asking young people when I'm doing my sensitizations, when it comes to sex, why is immediate gratification more important than delayed gratification? Kwa sababu hapa ni Gen Z sasa hii, like Gen Zs and millennials, I think issue ya sex, it's no longer a big issue the way it was kitambo. But the culture of immediate gratification pia ime lead to new infections, and especially amongst the young people. So as we come to Kabete National Polytechnic, let's ask ourselves, why is immediate gratification more important than delayed gratification? The other issue hata tuko nayo na shida as a country ni issue ya non-chemical addictions. And I'm sure ni Gen Zs and mnajua hii story, aviator. Si mnajua maneno ya aviator? Na kuna wale anacheza aviator. 3 months ago I buried my neighbor. He was around 26 years old. Because alikuwa ametumia around 650,000 kwa aviator. Na alikuwa ana fly kandege saa 8 ya usiku. Ati saa 8 ndio kandege kana fly vizuri. And really we have to, and that's sasa hiyo ndio point ile mimi nakuja. Why is immediate gratification more important than delayed gratification? The real world, by the way, haiwaki hivyo. The real world does not work that way. Unifanye job, ukuje usome, pate certificate, diploma yako, degree, but I think there are no shortcuts. There are no shortcuts kwa hii maisha. Alafu pia ni vizuri tujue tumekuja hapa, we are here for a season and for a reason. For a season and for a reason. Please, let's not forget that. So history you have to balance story ya internet na masomo. Because there's a sense of disillusionment pia hata kwa social media. And that's why I've been asking, nimekuambia mayouth sana pia, we also need to take a digital detox. Digital detoxification. Because at times unaingia kwa social media, unaingia kwa Facebook, and there is that sense of disillusionment. Unaona watu mlikuwa mnasoma nao, wengine wako US, wengine wako holiday Mombasa, Malindi. Then you feel that you don't measure up. Then self-esteem yako, the self-esteem goes down. So social media, kindly let us try to strike a balance. Then peer pressure. Because peer pressure pia, the issue of peer pressure inatuletea hizi mashida zingine. Peer pressure inakulead to alcohol and drug abuse. Because you want to fit into the crowd. The intersection between ADA, alcohol and drug abuse, and HIV, iko. NACADA last month had a report, and they reported that 18 to 24 years I don't know if you guys mliona your report. 18 to 24 year olds are the greatest percentage ya watu wale ambao wana abuse alcohol in the country. So as we come here to Kabete, tujue we are vulnerable, isn't it? But lazima we have to learn assertiveness and and have the courage to say no. Because I tell young people at times, show me the friends that you keep, and I tell you the kind of person that you are. So ni vizuri pia ujue umekuja huku Kabete, whom are you hanging out with? Right? Na hujakuja kucompete na mtu, hapana. Right? Because hiyo competition, if you want to compete, the self-esteem again goes down. So the intersection between HIV and ADA, yes, number one, alcohol diminishes your perception of risk. Alcohol impairs judgment. Alcohol makes you lose inhibition. Inhibition in counseling, ni kale ka shyness. Like one goes to a pub anaitisha ile chupa moja, ya pili, ya tatu. Then the fourth beer anamwambia letei balozi alafu kuje ukae hapa. That's what we call the loss of inhibition. So drugs and alcohol, they affect your inhibition yako. Then again, for young ladies, and tuko hapa, young ladies, in case you are intoxicated, are you in a position again to negotiate for safer sex? Can you say no? So kuna wale very young women wamejipata kwa shida ya HIV, STDs, unwanted pregnancies simply because of intoxication, which makes them not being in a position to negotiate for, especially issues to do with safer sex, ama hata ku abstain. And then for injecting drug users, that should be a big no. Because in Kenya, in terms of key populations, kuna watu ambao sahi risk yao ya kupata HIV imekuwa juu sana. Watu ambao tunaita PWIDs. Initially we used to refer to them as injecting drug users. Siku hizi tunaitanga PWID, people who inject drugs. There are key population in our HIV response, na wengi wameathirika na HIV. Kuna watu ambao tunaita, okay, then the second group, kuna issues against female sex workers. Kuna watu ambao tunaita MSM, men having sex with men. And now vijana ni vizuri tujue hata history ya anal sex is the riskiest type of sex. Na likelihood data ya kupata HIV, I work I'm a healthcare provider, hata risk ya kupata HIV inakuwa iko juu sana. So as we come here, ni vizuri tujiulize nini imetuleta huku? Kitu gani imetuleta huku? By the way, history ya sex, it's about choices. It's about actions. It's about consequences. Choices, actions, consequences.